henna for the the girls that are going to be in the fashion show.
Nice. She's super sweet. She's really, really sweet. My mom loved her.
Oh, yeah, she spoke very highly about you.
Oh, that's nice.
Yeah, ask what page is it going to be live on? What Facebook page?
Brother Hamza, are you there?
I don't see him.
You did. I think he is the.
Oh.
Yes, I'm here. The live is on.
On what page?
On our webpage.
Got it.
MCC.
MCC, okay. I'm gonna see if I can.
So I'm just gonna welcome as people are coming in. We're having heart-to-heart tea conversation on breast cancer. My name is Misbah, for those who don't know. So we're just gonna be waiting for a few more people and we're gonna carry on. In the meantime, we have a couple of my neighbors, Lubna and Lubna. We have Khawla, we have Safana, Sister Khalud, Aisha, and Shabana. Welcome you all.
Thank you.
Thank you so much.
Thank you so much for your support. It's so nice to have you guys. You guys are not just my friends and also supporters. So it's like amazing feeling to me that you guys are here.
Thank you.
Yeah, thank you. You too.
To my heart cause too, and the people who are here, not just my friends and also supporters. So it's like amazing feeling.
Yeah, we miss you.
So we're Shabana. Welcome, Shabana. Do you hear me, Shabana? Naureen, does Shabana call you about that particular kind of cancer that has to do with the nipples? No? Okay, she had called me, and since we're just talking here, we'll talk a little bit more about that if we needed to address that. If she had that question, and I addressed it to you. She had called me about it.
Okay.
Once we come to that point, we can actually answer that question. So the ones who are joining, just want to kind of give you a little preview for what's happening. I'm your host. My name is Misbah. I do represent Bloom, which is an organization for women exclusively, and it is at the MCC. So it's a new organization, but we are venturing out with different big organizations to support our women here at the MCC. For example, this month we are focusing on the Breast Cancer Awareness Month. So it's to empower women in occupation, in physical health and everything at the MCC. And you can see on far left, Ruth, Sister Ruth, can you raise your hand a little bit? She is our head director for the Bloom, and we are so lucky to have her as our mentor. I'm very proud to be working under her. She has a lot of experience in empowering women. And we have Ashma. She is obviously representing the Rose, and she is a pioneer also for the Rose, not just a breast cancer survivor. So she has a double story for us, and it is a beautiful story. And of course, we have Dr. Naureen Safdar here too, and she is amazing in telling you because she has been working in early detection, disease prevention in this field, and it's very close to her heart. She's been doing this for 20 years. And then lastly, but certainly not least, my last panel, which will be my first one when we are going to watch the video in a few minutes, and I'll explain you how the video would work. And that is Miss Rana. Miss Rana, can you kind of raise your hand? Yes, there's Miss Rana. And Miss Rana is basically, it's amazing, heartfelt story. It was hard for her, I can tell, to share her story, her struggle and fight, and how she encourages everyone to fight for breast cancer ahead of time. She had some regrets, and that she wants to basically talk about that do not delay. It's just her resources were slow. It was not her fault. So now we have the resources, so go for the resources. So that's why we're here, making the awareness that you do have the resources. Rose is one of the biggest resources, and we are advocating that at Bloom at the MCC, which you all know what the MCC is? Anybody who doesn't know what MCC is? It looks like we all, hey, how are you? I think that is Sister Alia.
Oh, I think it's my daughter. I can't find my name on here.
Oh,
I think it's my daughter. Oh no, it's my daughter's name. Let me change it.
Yeah, that's what I thought. How are you, sister? Good to see you, girlfriend. It's been ages.
I know.
I love it. I love it. It's wonderful to have all these women come here especially during COVID. So the idea behind this, I'm going to kind of start with this, and we're going to wait maybe another. Rubina, you.
I think
tell
you
me-
should start. I think you should start. Yeah.
I should start.
Yeah, we have a good number of people on.
Okay, let's do that. I am representing the Bloom. My name is Misbah Choudhri. I am one of the committee members, and Bloom is this incredible organization for women. In the month of October, we're focusing on breast cancer because of the October month. So the way our setup today is, we're actually having, see, I'm wearing my hat, and so is Rubina. I think she calls it a fastener.
I don't call it that. It's a fascinator, but
Fascinator. It's very
I think
fascinating.
yeah, it is fascinating.
It is indeed. Okay, let me just do something. Okay, so what we're going to be doing is we're going to watch a video, but it's going to be not a whole video. It's going to be all of us sharing our journey, quick pioneer our mission. So it's going to be 2 minutes of each guest panel will speak about this, and it's on a tea. What happens is that Ashma Moosa has been doing this tea, hats and henna tea, at the Rose every year, and it's been a big event. It's been overblown, mashallah. It's really great event. So we have, because of COVID, we made it a smaller. We wanted to come together. So today you'll see a smaller, but it's still, the point is the same. We want to bring awareness to mammogram, give free mammograms to women who are uninsured, moral support, finances, and all that. So that's a huge thing for us. So we are going to start with the video, and we have four guest panels actually, and we'll start with Miss Rana. And after Miss Rana, we'll take 2 questions, and then we'll have Dr. Naureen Safdar. It'll be 2 minutes of their conversation on the video, not that long, so be patient, bear with us. It'll be a quick, enjoyable event today. All of us at the end will actually have question and answer session too. But in between each guest, we'll have 2 questions. So we will take 2 questions. I think Dr. Naureen Safdar will be the most popular one for the today with her medicine background. So she will address any questions at the end, or any questions about Rose and how you want to be able to get the mammogram free. So we are going to get ready. Are we ready, Rubina, to start the video?
I'm about to share, yes.
Okay, great.
What's happening? Okay, sorry.
We are here sitting at this beautiful building called MCC, Multiple Community Center, Cultural Center actually. And my name is Misbah, and I'm a registered dietitian, also a health advocate. So I just wanted to talk about the Bloom. I am one of the committee members here, and that is the goal of us here talking about wellness, because Bloom optimizes the lives of every woman here, and we do programs for women where they can have an optimal life with physical, emotional, and practical health care. So to create programs here to help women achieve their goals and live their best lives through empowerment, occupation, and wellness. And today our focus is wellness. So we'll talk about wellness. So let me introduce you to Miss Rana. She is a cancer survivor and a principal at Houston Peace Academy. She will share her beautiful journey of fighting breast cancer and how Rose helped her to that journey. And Ashma Moosa is going to basically talk more about the Rose. And you can, Sister Rana, start with the prayer if you would like to.
I pray to Allah, the Creator, to grant us all strong health, and to grant all who are sick a cure, and to grant us the strength to help one another and to be there.
Oh, he's a little pretty boy.
Thank you, God. I'm a survivor, and I've been a survivor for the past, actually, now I just marked my 5 years. It was a hard journey for sure, and it started at Rose. And that's one of the things that I will never forget, because I got the help that I know many women may not get, maybe because they don't know about the Rose. But one of the things that I was struggling with is I was struggling to find someone to do the biopsy. I was struggling to find my even results. And when I went to the Rose, the most accommodating, I felt so comfortable being there. It didn't take any time. They did the mammogram the first day, next day the biopsy, and they were very comforting, very helpful, and I started my journey of treatment after that. So yes, I hope that every woman would seek help as soon as they feel that they need it, because it's very important to seek it. Thought back at that time, and why didn't I get my physical run earlier? Why didn't I go to seek my mammogram earlier? And I think that's one of the things that I cannot fix, but I can ask other people to take care of themselves from the beginning, so they don't have to go through what I went, because I was stage 3, and that required very harsh treatment. And I wish that people would take care of themselves from the beginning, or women in particular, that they take care of themselves, that they don't need to get any harsh treatment, or probably get even help earlier where they have prevention.
My next guest is Dr. Naureen Safdar, also very close. A good friend of mine. She's a board certified.
Misbah, you're on mute.
Okay, so can you hear me, guys? Okay, so that was a very heartfelt struggle and story of Sister Rana. It was amazing. Thank you, Miss Rana, for sharing that, because she really went through a hard time. And from that struggle, she wants everyone to learn that we have resources. So reach for it. Don't give up no matter what. Resources are there, even if you're uninsured. Don't let the finances be the reason to not have a life-saving test. So we will take a couple of questions for Miss Rana's journey. If any question, if anything concerning, we have Hamida, thank you for coming, joining. Aisha Zahid, Fatima, Zuhayaz, and we have Safina, Saima, thank you all. I'm so excited that you all are joining as we speak. So we'll take a couple of questions. So if you are ready to speak, we just kind of raise your hand. I know, how do we want to do this, Rubina? How would we take questions?
I can't see the icons on the bottom, so just I guess raise your hand if you have.
Okay, so you kind of have to show your face. So I have only 5 people. I have Tamara showing her face, Samaya is showing her face. Face sounds funny, but we have Lubna and we have Sister Hamida. So if any one of you want to ask a question, you guys kind of raise your hand, or I don't want to exclude others, but I can't see your faces. That's the only thing.
Ask it on the chat.
Yeah,
we have one that came up on the chat.
Okay, so let me start the chat here.
Yeah.
Okay, so the question,
I have one question on the chat. Do you see it, Misbah?
Let me see.
Somebody asked Sister Rana, what was the most important thing that got you through, or what would you say was the top most important things that got you through your journey with cancer, to keep you positive, kept you positive throughout that?
Well, the honest truth, going through it is not easy, and you have your ups and downs. The most thing that really, this is something, 2 things that you need during your journey. The first one is you need your faith. I mean, this is the most time that the faith will help you. Your prayer, you're believing that, He is the one who created me. He's the one who's going to take care of me, no matter how hard it is. The other one is you need someone to listen. This is your support. is someone who listen. They say a shoulder to cry on, and maybe that's what it is. It's just someone to listen to your struggle, not to tell you. And I'm gonna really confirm this, or I'm gonna stress on this. A lot of people, they think that they're helping you out when you're telling them about your struggle by saying it's okay, you're gonna get reward, you have to be patient. I'm sure you were trying to be patient as much as possible. This is not the time to tell anybody to be patient. It's the time to listen to the struggle, because you want someone to hear you out. You want someone to understand the pain that you're going through. That's the only thing you can do about your pain during that time, is just you want to filter out. So for someone to tell you it's okay, it's not okay, the pain is not okay. And we know that, yes, being patient is rewarded, and we have to be patient. And that's what we were trying to do during the sickness. But what you need to do is really two things. Is you need your faith, and you need some support. And I guess I remember calling Ashma several times, and she would listen to me, or even when she would visit, she would listen to me. She doesn't, stop me to say, oh, it's okay, because that's something you don't want to hear. The sick person doesn't want to hear it's okay, because that's your pain that you're going through, and it's not an easy journey. But we believe inside that God is taking care of us, and hopefully that's the only way to survival. It's just we need that friend. It's very important to have your support.
Thank you so much.
One question, sorry. I know you mentioned that you were stage 3, Sister Rana, when you were diagnosed. Did you have an idea that you might have a lump, or may have something? Did you feel anything wrong, or was it stopping you that you didn't have insurance, or you just or it was a complete surprise?
It's so unfortunate to say I didn't have time for myself. That's what was the problem, is that I was so busy and putting myself last, and I knew that I have to have a mammogram. Unfortunately, there are some type of cancer that it's a surprise. It's not like you feel a lump or something, and that's just I had carcinoma, and that's a different type of cancer that you don't have it as a lump. So no, you don't feel it until a later stage, and that was the problem. That's why it's so important to check up, to go for your mammogram, to go to see your physician once a year, because it will hit you. I mean, it's just like when I felt that there is something wrong, I knew that it was something huge, because it couldn't hide itself anymore. But I know I did not feel anything before. Of course, you have some symptoms and signs, but we all, women, when we're overdoing it, we have fatigue, headaches, and we just say, it's because I didn't sleep well, it's because of this and that. So you keep putting it aside, but really you should just always take care of yourself. Yes.
All right, thank you so much. We are going to go to our next
Can I just ask a quick question, Misbah, before we go?
Yes, we actually still have a little bit more, Stefana, with Miss Rana's a little bit more of her heartfelt conversation, where she's going to tell you a little bit more in depth how to deal with this and how she talked to her kids about it. But go ahead, Stefana.
Assalamu alaikum, Sister Rana. I have a quick question, is that we are taught how to talk to our patients in a more empathetic way, but often I feel that sometimes when people know somebody has cancer or they're terminally ill, they want to do the best. They want to actually reach out to that person, but they don't know what to say. I know you mentioned what we shouldn't say to the person, but what is something that would be appropriate to say to that person?
Well, I think it's just like, as using the iMessage in many things, it's very effective. It's just like, I understand that you're going through a hard time. So I'm here for you whenever you would like to talk, whenever you need someone to talk to, or if you need any kind of help. I think this is how you can start and address it. It's just like, we have to understand that it's not scary for the person to talk about the sickness. I mean, most likely that it's not something to hide or be embarrassed of. And maybe at some cases, some people feel that way. I think the patient is waiting for someone to reach out. The feeling when you are a patient is you don't want to burden someone out, but when somebody open the way for you, I think it makes it easier for you to reach out.
Thank you so much.
You're very welcome.
Thank you, Rana. You gave a really good concrete example of how to talk to people when they're going through something as sensitive as breast cancer. And that was really important. So we're gonna shed a little bit of light on how you talked to your kids about this the first time and how you dealt with it. So it's kind of important to know. I think that's the next part, Rubina, or are we?
I think we already passed that. I think Dr. Safdar is speaking.
We'll go to Dr. Naureen Safdar, and the introduction is in the video. So just bear with us, and we're gonna go to that now. And then we'll get to questions.
My next guest is Dr. Naureen Safdar, also a very close good friend of mine. She's a board certified in both internal medicine and obesity medicine. Practices preventative medicine with emphasis on early disease prevention. So this is up your alley with disease control and prevention. So you want to talk about that, Dr. Naureen?
Thank you, Misbah, for that wonderful introduction. This is so close to my heart because for 20 years I've been prevention, early disease detection. And nowhere is early disease detection more important than breast cancer. The earlier we find it, the better the outcomes. You know, breast cancer is the second most common cancer in women after skin cancer, and it is the #2 cause of death in women. It's so preventable. Early detection can mean cure. 50% of newly diagnosed breast cancers occur in women in whom we can identify risk factors. 10% occur in women who have a family history, and 5 to 6% occur in women who have the BRCA gene, which has been associated with higher risk of certain cancers, including breast. Mammograms are the best way at the present time to screen for breast cancer. We start talking about doing breast screening at age 40. Different societies have slightly different guidelines. Most of them say at 40, we start doing them every 2 years. Some say continue to do them annually, but after age 50, they are recommended annually. Recommend stopping breast screening at age 75 because at that age, the incidence of breast cancer goes down fairly drastically. In some women, we start earlier because of family history or genetics. The best way to find out what is right for you is to make sure you talk to your doctor about it, get your annual physicals, and get referred for the appropriate testing. In younger women under 40, we are more likely to order a breast ultrasound because the breasts are denser, but again, your doctor can identify which would be the best screening method for you.
So Naureen, tell us who would be the high risk for breast cancer? It's an excellent question.
People who are at higher risk for breast cancer are older women over 50, menopausal women, women who have been using hormone replacement therapy after menopause for at least 5 years, women with a family history, as we mentioned earlier, family history of breast cancer with BRCA genes, or have family history of ovarian or other cancers. Caucasian or white women are at higher risk. Next come Black women, then next come Asians and Hispanics and people from sub-Saharan Africa. One thing I'd like to really point out is in African American women, women who are, it tends to occur at a younger age, less than 40. They also unfortunately get diagnosed at a much more advanced stage of cancer, which really affects their mortality. So in African American women, I really recommend that they discuss this with their doctor and make sure they see them annually for a good breast exam.
Thank you, Naureen. That was such a thorough answer. I love that. And very important for us to know that. So I'm going to ask you another question. How can we reduce the risk of breast cancer?
Oh, that's a wonderful question because there are things women can do to reduce the risk of breast cancer. Definitely smoking and excess alcohol use increase your risk. So those are things that you can change. In postmenopausal women, if you are overweight with a body mass index of over 30, particularly if you have a high body fat percentage, That increases your risk. You can also reduce your risk by regular exercise and the type of food you eat. A diet that's rich in fruits and vegetables, low fat, make sure you get enough vitamin D and calcium in your diet. The Mediterranean diet has also been, in some studies, shown to reduce the risk of breast cancer. Foods that have plant-based estrogens, such as phytoestrogens, for example, soybeans, legumes, can also be very beneficial. Anything that reduces the exposure of your body to estrogens. So example, if you have onset of menstrual cycles later, over age 14, if you have, that reduces the risk. If you have late menopause, that can increase your risk. Also, breastfeeding for at least 12 months and having children earlier in life rather than later have been definitely associated with a decreased risk of breast cancer.
Oh, thank you. So, Naureen, any last thing you would like to advise us?
Absolutely. During the pandemic, a lot of screening mammograms have been on hold because facilities are closed. They are now open. I actually went and got my mammogram in August, and they have excellent protocols in place to keep you safe. I really encourage you to go. I've been referring many of my patients to the Rose, which is a wonderful facility, and Ashma can tell you more about the Rose. Thank you.
Here I would like to introduce to you my last guest, Ms. Ashma Moosa, and she is a registered nurse and also a cancer survivor. She is an integrated health coach, executive board member, volunteer at the Rose, and she'll talk about Rose in detail. She will share her personal journey and experience in the mission of the Rose. So tell us, Ashma, how was your experience with Rose and your roles in it?
First of all, I'd like to thank MCC for hosting this program and letting me be part of it. And Sister Rana and Naureen, you both are great supporters of the Rose and always have supported me in my mission. So the Rose is very dear and near to my heart because I was diagnosed there as a insured woman. So the Rose actually also takes insurance besides taking care of women with no insurance. So the beauty of the Rose is it's really it's a beautiful way how you can give back. Is if you have insurance and you're due for your mammogram, every 3 women that have their mammograms done there would help 1 woman without insurance to get their mammograms done. And so when I was diagnosed there, I had promised myself that once I would get through my journey, which was quite difficult, and it was something that I wanted to give back. That there was one day in particular that I really fell to the ground, and I thought to myself, with the chemotherapy that I was getting, that I don't think I can make it. And that's the moment when I started really praying and thinking about positive things. And I promised myself that if I can get through this, I'm going to serve my community. And I am so happy here today, sitting in front of you, saying that I am almost 11 years cancer-free from my second cancer, which is breast cancer. And the way I give back is I volunteer my time. And that volunteering my time with organizations such as the Rose really gives me hope, and it gives me something to live for. It has actually given me a purpose in my life to empower women. And whenever I get a call from a woman, she's struggling with her diagnosis, I take the time to listen to them, because listening to somebody and giving them that time is so important when they're going through something like this. And I can't tell you how many women I can count on my fingers that I have met through the Rose, through other organizations, through community outreach, that either have lost their journey with breast cancer. And a lot of them have survived through breast cancer. So breast cancer is something that you can beat it. Prevention is the key, like the doctor said. You must get your mammograms in time. Don't skip a year, don't skip months. Just go in and get your mammograms done on time.
Ashma, how do you champion the cause of the rose?
So how I champion the cause, I'll tell you a short, quick story of how I really got involved with the rose. After my first year of survivorship, I wanted to thank my family and my friends in a very special way. And I do have a passion for tea, as you can see. We're set up for tea here. And so I decided to do something very personal from my heart. I had a tea party at my home with the same type of setup, made it all food to thank my family and friends for standing by me. And every year it became like a tradition. The more survivors I met, every year my tea party got bigger and bigger. So when I started serving on the board of the Rose, I told Dorothy, who is the CEO of the Rose and the founder, and she's a dear, near, close friend of mine, and I told her, I said, you know, I would really like to do something special since I'm on the board now, and I would like to make my tea party into a benefit. So I decided to have it at a small tea room, and I thought it was going to be just 50 people, and it got sold out, and I was able to raise $5K at that party, and I gave that to the Rose. A lot of people were upset because they couldn't come and be a part of that tea party, so then they approached me and they told me, they said, you know what, we'd like to make this a signature event every year. So the following year, we went to a bigger venue, and from there on, it has gotten bigger and bigger and bigger. And so this is how I champion the Rose and their mission. It's really a ministry for me, because when you look at the mission of the Rose, it's so beautiful. You know, 3 women with insurance, because we're paying such a high rate of insurance. We all know whoever pays insurance knows how much we pay for that. So if we can go to an organization that's going to do our, female checks, and that's going to go back to another woman that doesn't have insurance and is unable to pay, or she's a single mother, that $250 is a lot for her to pay for her mammogram. So she always pushes it back. So the Rose steps in at that moment. And so, like I said again, I want you to walk away from this tea party listening to the survivor, the science behind it, and that, being a survivor and my journey along with it, that I have made it a mission to empower women. And every woman should, whoever is empowered, please share that with another woman and empower them. So this is my mission with the Rose. This is my, way of giving back. And thank you again for bringing light to this and having me here as a co-host with you. And I hope that you will join us in my virtual tea party that I'm doing soon. And hopefully MCC will let you know when that will be. And again, thank you, Misbah, for hosting this. This was beautiful.
Thank you. And thank you. And I can see your heartfelt mission. And thank you, all of you, for being here. And the heart to heart with the tea for breast cancer. And we can see everybody's heart is here. So we will open up for question and answer session.
So guys, we are open for question and answer session, like we promised. Can you hear me, guys? Yes? Yes? Okay. Perfect.
Yes, we can hear you.
Awesome. Okay, so right now we had amazing, interesting, basically from Miss Ashma, how she went through Rose and all that and her mission. So any questions for anyone? We have Kola, we have, I can't tell, but there are people here. If you guys want to just Ember, Khalud, El Fokoya, thank you everyone. If you have any questions, please go ahead and ask. Don't be shy. This is the time. Okay, Tamara, Sumaya has a question. Sumaya, perfect.
Yes. Okay, Assalamu alaikum.
Walaikum salam.
Is the Rose, is this at one location or is it different locations throughout Houston?
So there's 2 locations. There's one in the southeast, which is on Featherwood off of 45. And then the other one is in the Galleria area. So you have a choice of going to either one of them, whichever area you're living in. So, you can go online and make your appointments. It's therose.org, and you'll be able to find all that information there.
And how do you get help if you're uninsured? How do you, is that all on the website or?
Yeah, that's a really good question, because a lot of women think that they can just go there and get a free mammogram. Well, the Rose has to go through some steps in order to, get you that mammogram and qualify you for it. So they do require you to have a prescription or, a written order from your family doctor. And then you call them, they put you on the schedule, and then they'll send you some information by email. You have to fill out those forms, and they do a little, check on you to see if you are able to afford it or not able to afford it. You just need basic financial information. And so it's very, very basic, but they have to show that in order to get you that money from the grant that they get.
So you have to go to your regular physician at first and say, I'm interested in getting a mammogram. There's a place called the Rose. Can you? So it's basically go to your main physician first.
Yeah, actually, we get more women that have no primary care physicians, so they just call the Rose. And my husband actually helps them with that as a courtesy. We will go ahead and see them as a courtesy in our clinic, and then write that order. So they do have my husband, Dr. Moosa, that does that as a give back to women that don't have insurance, and then we'll follow up on that mammogram just to make sure that things are all okay.
Okay. Thank you.
Thank you for the very intriguing question, because that's important. Where do we go? And we have resources there. As a matter of fact, Sister Rana was in another state when she was able to come here from that state to come to Texas to get her testings done. So even if you are in another state, you can go to Rose here. And I'm sure, I don't know, maybe Ashma knows in other states, but right now we're focusing on Houston. So the questions, we are here for open question session right now. Kaula, you have any questions? So anybody here knows a very close breast cancer survivor?
I didn't have any questions. Thank you, guys.
Okay, Kaula, go ahead.
Oh, I didn't have any questions. Thank you so much,
Okay, got you. Thank you, Kaula. Naureen wanted to say something about her sister, I think.
Yeah, I did. This is my younger sister, and it really hit us, really hard, because last year, October, she was diagnosed with breast cancer. And I, as a physician, panicked. I mean, I just, as a doctor, you think the worst, you think, what could happen. It was such a shock for the whole family. She lives alone in London, and my parents were in Pakistan. I'm over here, so she was by herself. And, it was an excellent question earlier. How do you support? I made the mistake of wanting to comfort her, get opinions, do that. And, retrospectively, that was not what she needed. She needed exactly what Sister Rana was saying. She just needed me to be there. Now, I was there. I went for her surgery. I went whenever she had chemo as much as I could, then COVID hit. But she needed not to be, for me to be the doctor. And she actually got upset at me a few times when I was I wanted her to come here to MD Anderson to get a second opinion. And it was just too much for her. So one of my oncologist friends gave me excellent advice. He said, this is not your journey. This is her journey. And you are just there to help her. And you cannot make decisions for her. And once my friend told me this, I sort of backed off, and exactly what Sister Rana said. I am here. What can I do for you? I'm doing the laundry. I'm cleaning the house. I'm cooking food. That was what she needed. And then that's what I did. And I just wanted to give that perspective. from a physician and then from a family member who, you know, it impacts the whole family. And I'm sure Ashma and Sister Rana can speak to this much more, but it impacts the family in such a way, the whole dynamics. And we have to be careful not to make it about ourselves, and that it is really about the individual going through the journey, and just be there to support them. So I just wanted to say that, put that out.
Dr. Naureen Safdar. Speaking about impacting the family, I think Sister Hamida has a question. We'll go to that, and then I'll talk to you about the BRCA test. So let's and talk to you about some other couple of things. Go ahead, Sister Hamida.
Okay, Assalamu alaikum, everyone. Hi, Ashma. I just want to say that I'm related to Ashma.
Ooh.
Yeah. So we went through a lot for her when she was going through. It's good to see that this is a good support of the group you have in Houston. By the way, I'm from Canada. So when Ashma was going through, we all went through with her. But alhamdulillah, she's okay. And we always prayed for her. So we are very close. You can say I'm her older sister.
Yeah, Hamida, thank you so much.
Thank you.
I've always been there, and this is what it takes. You know, sometimes you don't have anybody close by, but just her calling me was enough, and letting me know that you're going to get through this.
Yes. And alhamdulillah, you know, she was quite a fighter, and the family was around her and a good support. But one more thing I would like to say that with the Canadian government, we are very fortunate, especially Ontario, that's where I live. And our family physicians, after 50, a woman has to have the mammogram every 2 years, mandatory. And you get a letter from the federal government plus the Ontario government. Then after 55, you have to go every year. And as I said, we are very fortunate. We don't have to worry about our insurance or anything like that. But yet, many women still don't go.
Yeah.
So now they have, as I said, the Canadian government has put down a foot that no matter what, every woman after 50 has to go, after 55, every year. So
I wish I could do that here as well.
Yes.
It's kind of an individualized kind of thing, you know. Sometimes you skip that yearly checkup or whatever, so you're going to miss that mammogram. And hopefully, you know, if we can go out there and vote for these things, making sure that we have the right to do all those things and make a change in our policies. I think that's where, and actually it used to be where they used to pay for mammograms at 40. So now they pay, your insurance only pays when you're 50. So what does that tell you?
Yeah.
That there will be so many women that are going to be diagnosed and they don't even know there's a silent lump sitting there.
Why is it, you know, you would think it'd be the other way around.
Yeah.
Yes.
So,
well, I think part of the reason for that is some studies have shown that in a younger woman, when we do screening, that we may be doing more harm than good, because you end up finding things that then require further testing, may require a biopsy, but the majority of these end up being benign, and it causes a lot of stress and worry. And obviously, you know, they're looking at it from a financial standpoint as well. So the guidelines, and because a lot of the national societies are also changing their guidelines, you know, insurance just needs any reason not to pay for something, right? So it's unfortunate, you know, in Europe, again, guidelines vary all over the place, but in certain countries in Europe, they always do an ultrasound with a screening mammogram. That's just their routine, which I think is fabulous, because there are things that you cannot see on a mammogram and you see on an ultrasound, especially in women who have very dense breasts, because, you know, mammogram is an X-ray. It can only penetrate to a certain degree. So if you have very dense, which means very tight breast tissue, it's just not going to penetrate through. And ultrasound is another way to really look at the breast in a deeper way. So unfortunately, guidelines vary, and but that is one of the reasons, you know, they.
Well, you know, Dorothy, she had gone to Washington to fight about this.
Yeah.
And come to find out, when she really looked into a lot of the things, those studies were done very early.
Yeah.
So, you know, there is no comparison to those studies. They should have had recent studies where the women are getting diagnosed earlier.
And the other thing is you know, as with anything, with time, our diagnostic procedures, our screening, you know, doing 3D mammograms, we didn't do those 10, 20, 15 years ago. So, you know, our non-invasive diagnostic procedures have improved so much that, like you said, old studies really may not be as relevant nowadays. So, it's unfortunate, but hopefully somebody will do those studies and we can go back to screening appropriately.
So in my case, you know, there is no genetics as far as, and yeah, so, but now that my daughter is 25, I know it's not genetically, I'm not, you know, hopefully she's not going to, but I am going to go ahead and get her you know, ultrasound and a mammogram done baseline at her 20, you know, at this age. So that way we can keep an eye on it and keep a surveillance on it.
So there used to be a guideline of doing a baseline mammogram at age 35 and then starting annual mammograms at 40. But again, that has changed, unfortunately.
But, you know, unfortunately, we see women, again, at 26 being diagnosed.
Oh, it's getting earlier. And some of it may have to do with demographics, lifestyle, environmental, you know, ionizing radiation that we are all exposed to. You know, things have changed in the last 50 years. And so, you know, the demographics of the people who are getting this and getting it earlier, it's like with our children who are getting obesity and diabetes and hypertension at a very young age, teenagers. So a lot of it is lifestyle. And that's what I tell women, you know, you can't change your genetics. If you're going to get it, you're going to get it. But there are things that you can do in terms of your diet, your exercise, having a healthy weight that do reduce your risk of getting it, you know? So that's important to recognize, I think.
One thing I heard recently from a doctor a couple of weeks ago, she said that because of COVID, and Dr. Safdar, you touched on this as well. Because of COVID, people have lost their jobs, they've lost their insurance, and then just facilities being closed in itself. So, you know, people being scared to go out. And just during this period of time, this 6-month period, they estimate that 100,000 cases of breast cancer will be misdiagnosed by the end of this year. I just thought that was like a staggering number.
It is, because a lot of the women have lost their jobs. They don't have insurance. So what we saw at the Rose in the appointment scheduler was a lot of women were canceling their appointments because they no longer have insurance, unfortunately.
Yeah. So one question I have is, so say you get diagnosed, you have a mammogram, it comes back, you know, positive for cancer. What is the next step? What should somebody do? Medically, like medically speaking, what are some of the things that you can recommend that somebody do? Because I mean, there's just so many things I'm sure going through that person's mind. So they took that step, they got that mammogram, and now it came back positive. So is there any guidance that you can give, you know, about what the next steps are that maybe a person can do?
Is that question for me or?
For anybody, Sister Rana, somebody who's been through it, I guess.
I would say that definitely do your research, okay? Learn to find out what your stage is and what your oncologist is recommending, and basically move fast. Don't sit there and, you know, say, oh, I'm gonna go next week or maybe a week later. No, you need to get on the ball with that. If you're not satisfied with something, like in my case, I got second opinions done. So that way I could get a clear picture of where my prognosis was going. I was told I would be fine with a lumpectomy, but deep down inside my heart, I felt this was my second primary. I just want a bilateral mastectomy. And so there was a little bit of resistance there. Again, I did my research, I talked to a few physicians, and then I made my decision. And one thing you have to remember that with breast cancer, women have lots of choices. You have a lot of choices to make, and it's your personal choice, not somebody else's. Don't let your spouse or your sister or somebody influence you and say, no, you should just do. No, go with your gut feeling. And I think once you feel that sense of peace, that's what I was looking for. And alhamdulillah, it all worked out okay. Yes, I did have a bilateral. I had a transplant. It was a 16-hour surgery. But now when I look back, they told me we would have not done a lumpectomy. We would have actually removed one breast. And these things, you can only do it one time. You cannot go back. So these are the things, and that's why we are here. I am here. If anybody needs to talk about it, everybody's diagnosis and prognosis is different.
That's true. And if I may add one thing, you have to listen to your guts too. And also do not let anyone force you into anything. Sometimes even it comes from the physician side, where, when I was going through my chemo, I felt like I was dying from the chemo. And I told the doctor, we're stopping right there. I'm not going any further. The nurse will call me and try to convince me into going further because, supposedly that's what's going to kill the cancer. But the problem is I felt that I'm going to die before even finishing the chemo. So you have to really speak up for yourself. If you feel there's something that's bothering you, there is something. I was literally not able to get up. And I felt that I'm getting paralyzed. And I told the doctor, if I'm going to live, I don't want to be paralyzed. And they stopped the first chemo and they gave me a different one. And I was afraid of it because I knew what the side effect going to be. And I ended up really dying in a hospital from pneumonia. So the thing is, you just have to speak up. You have to talk to the doctor. And, at the end, when I went saying, that's it, I need to stop and go for the surgery and radiation. And the doctor was saying, we're going to see about that. I said, well, I'm not going for it anymore. That's it, because that's the way I felt inside me that I cannot do that anymore. So you have to speak up. You have to talk to your doctor about how you feel, and you have to tell the doctor that everything is going on with you too.
I would second what both of you said, that always get a second, third, fourth opinion. Until you're satisfied, it is your body, it is your decision, and you should be comfortable with whatever decision you make. Do it quickly. Like Ashma said, don't delay things too much, but it's a balance between being satisfied with the decision you make and doing it in, doing it quickly. Yeah.
I mean, the outcomes of a mastectomy versus lumpectomy, they were a little bit, they usually are not in favor of that when you're a young woman, because emotionally it's very hard to, accept that. And yes, it is emotionally, and that's a whole other topic that we can talk about is self-image, what women go through. I can tell you a ton of things that are not the perfect thing in my body anymore. I had early cataracts. I have scars, I have a neuropathy, but if I'm going to sit here and focus on those things, I look at the bigger picture. I got rid of the cancer and I'm cancer free, and I did everything possible to bring my odds down, the percentage down. I even took a drug that is, known to, go after that particular protein, which is Herceptin, because my cancer was very aggressive. And I didn't know that when I walked into the surgery. So things can change along the way too. But just like I said, if you don't know what's going on with your cancer and you just don't understand where you're at, what kind of cell it is, learn more about it, talk to people. And there are people, you're not alone. That's always my thing, is that you are never alone. There's always somebody there that can reach out to you, but you have to be the one to make that gesture. It was very difficult because my husband's a family physician. So when it came to, asking questions, he would just turn it back around to me and he says, listen, this is your body. You decide what you want to do. And I really respected him for that. So it is very difficult when you're in the medical field and you know too much.
So thank you so much, both of you. I have a quick question from a couple of people. One is, question is, does the Rose have a mobile bus for mammograms?
Yes, we do. We actually have 2 mobiles right now. We have Rosie and Misty, and we are going to have one more coming. So we're really excited. So that
was going to be called Ashma.
Maybe they would, the amount of things I do for them. But yes, they do go. Actually, the Rose does not just serve the Houston area. They go throughout Texas in the small pockets where there's no health care. And that is also a lot to say about them. They go to some really, really small areas in Texas that they have absolutely no care. So yes, we're getting our 3rd, and that's why we rely on the fundraisers that we do for the Rose. This is how we fund things. People will randomly sometimes be anonymous they just call us and say, we want to give this much. Maybe a husband or a wife went through something and the husband wants to give back. And that's how the Rose, actually takes care of everybody with the mammograms, with the mobiles, with all these things that they do for the women that have no insurance.
All right, thank you. And one question I have, another one from Fatima. Fatima, are you there? Fatima, did I have their name? Fatima, are you still there? Oh, there
Yes,
she is.
Assalamu alaikum, ladies. Thank you so much for gathering and educating on us about the Rose and about breast cancer awareness. So I have a question. The 3D mammograms. Is 3D mammogram something that you take, that you do every year? And what are the risks to do a 3D mammogram opposed to like a regular mammogram? Does anyone know?
I'll tell the doc to answer that.
Oh, okay. I was gonna say, I don't think anybody is doing what we call regular mammograms anymore. I think it's pretty standard, if I'm not mistaken. And I know Lubna Choudhri is on the line here, one of the other doctors, so correct me if I'm wrong. But I believe the 3D is, first of all, it's better. It's more sensitive that we do this. And a lot of women won't do the 2D anymore. And I don't think many places do them anymore. There's been a lot of questions. Sometimes I get patients asking me, I'm worried about the radiation from,
yes.
Or even when I had smokers, they would say, I don't want to get an x-ray because of the radiation. I'm like, any of you that fly internationally, do you know how much radiation you get when you fly in an airplane? Most of us don't realize this. When you fly transatlantic or whatever, you get the same amount of radiation that you would get from 1 or 2 x-rays. So in the scheme of things, whenever I'm ordering a test, any test, not just a mammogram, you look at 2 things. What's the risk versus the benefit of this test? Do I have more benefit from it? Do I have more risk? And what am I going to do with that information from the test? If the test I order is not going to change what I do, I'm not going to order the test because it's not going to change what I'm going to do. What's the risk? That's one question. The other question is risk versus benefit. What is the risk of doing the test, and what is the risk of not doing the test, and what's the benefits I gain? So the benefit of finding breast cancer early far outweighs the risks of any minute radiation you may get. So I would think of it like that. That's how I explain it to my patients as well, that any medicine you take Tylenol, ibuprofen, there is risks associated with it, but you still take it because you're for the benefit for it. So I think we need to look at everything that we do, whether it's a test, medication, decisions we make, those balances. Am I going to change? Will it change what I'm going to do? Is it benefit to it? Is there risk to it? And does the benefit outweigh the risk? So if you think of it that way, early detection, you know, some people will get away with just a lumpectomy. You don't need radiation, you don't need chemotherapy. Can you imagine that if you didn't have to go through that? Sister Ashma and Sister Rana are right here to tell you how hard that is. So to me, early detection and getting it out is financially, emotionally, psychologically, there's much more benefit to that than harm. And that's how I would look at it. And if others want to comment, you know, I know we have doctors in the group here, and, you know, feel free to comment.
Yeah, because this 3D is something new, I think, right? It's not, I think in the last 2 years it has come out. It's very
maybe even 3 or more. Yeah.
It's been about 5 years or more, because I know that when I was going through my journey, they had me do the 3D.
Yeah. Oh, they did?
It's been, yeah.
It's been a while. Yeah, I think it's longer than a few years. Yeah.
Oh, okay. Now for me, it was prescribed for me, I think, last year, and that's what I was like. That was new to me, and I want to know what were the risk factors on it.
Did you get it done?
Yes, I guess, yeah, I got it done because I think they categorized me as high risk.
Oh, okay.
So that's a
and I also wanted to say something about the rows. I also want to say, apart from what they do, they're also very professional.
Yeah.
I compared, because at the beginning when I had to do my ultrasound, I went to a different hospital, a well-known hospital, and basically the professionalism from them I was very disappointed. They didn't contact my doctor, give any information about my mammogram. It was a very frustrating process. And then finally, by chance, I heard about Rose, and for the next mammogram, I went to Rose. I was like, okay, let me try this place. And I was really impressed. They contacted my doctor, they contacted me, and from that day onwards, I've never gone anywhere else. So they're very good.
Thank you. I'm sure the Rose is watching probably, and they'll be very happy to hear that. And that makes me proud to serve this beautiful organization. Thank you for my comment.
So I'm cheating a little bit. I looked it up today. And so the effective radiation dose received from routine screening mammogram is equivalent to the dose received from natural background radiation over 3 months. So in other words, when you get a mammogram, you get the same amount of radiation you would have over 3 months just from radiation in your environment. So that's something I think that should reassure people. I mean, that's very important. And your other question about the 3D, so there are two things. One is we now do digital mammograms, which are different from the films that we used to do before. Before they take it, they had to develop a film and do that. Now they do digital mammography. So they take a picture and it goes to the computer, and they can magnify, they can enlarge. And with the digital mammography, we've significantly improved finding very small early cancers that may not have shown up with the film. So that's one thing that's relatively newer. And the other thing would be what we know as a 3D mammography. And that also increases significantly the cancer detection rates and may increase you get more false positives with it. So what that means is with previous mammograms, you'd find something and you couldn't really tell, and you'd have to do additional studies and had to go get a biopsy. But now with the 3D, it is much more sensitive. So we can say, okay, this doesn't need biopsy, or this needs biopsy. So you get less false positives. So I hope that answers your question, Fatima. But
thank you so much. Yeah, okay. Thank you so much. That explains a lot. Thank you so much, Naureen.
And thank you, everyone here, for good questions, because those are valid questions, and I'm learning so much about breast cancer myself. And I think it's a great opportunity that we have all this awareness and resources, and we can actually share this and empower each one of us. So anybody wants to share their last thought, I'm just going to mention the sponsors, especially the MCC, which is the Multicultural Center. It's a beautiful building with a beautiful mission for the community. They have reached far and beyond our expectations in the community. and helping and growing as we are growing and adding more programs exclusively for every gender-based and youth. And now we are blooming literally into a bloom. So I think it's called a bloom. So I think it's beautiful that we are growing and we have each one of your support. I wanted to quickly mention the sponsors here. They were great to do this for us. Dr. Farah Siddiqui, and we are, by the way, live on Facebook. So show your pretty faces, your rose faces. We are on live, and Dr. Salman Mia, he is an innovative pain management center, and Dr. Mrs. Saeed Khalid, Baytown Periodontics and Dental Implantology. So, and also please do donate. And that's the whole mission about this, to empower other women. We can support in many ways. One way is to just donate $50 or $250 to really cover the mammogram and spread the life of the beauty of this rose and the beauty of the any other questions? We are going to continue this awareness through many missions of Rose, and we'll continue this effort through another tea. And next time, I think we will put our hats on, and
we'll still have a chance to wear hats next week, because my tea party is next Sunday, and I expect you all to be there. Awesome. Because we're going to have a conversation with a male breast cancer survivor.
Oh, wow.
My close friend, him and I worked at MD Anderson together. And so I wanted to bring awareness that this is not just a female disease, this is a male disease as well. And we are going to also have, once again this year, a beautiful fashion show by Shaila Rana. She's going to show off her beautiful outfits. And what she's done is she's made some custom made masks. So those will be, so please join us next Sunday.
We're going Baroque style.
Yeah, exactly. You got to really pump it up. Yeah. So please join us. And if you need any information about the Rose, I am always available. You can look me up on Facebook. You can talk to the ladies here from MCC. If you hear of somebody that is going through a journey and it's very difficult, I'm happy to talk to them. So please sign up for the next Sunday tea party, Hats and Henna, High Tea. It's on Facebook, so please register.
What time?
It's at 2 p.m. next week.
Is there a page or something that Rose has that we can always see?
Yeah, you can actually go to Hats and Henna High Tea 2020, or you can go to therose.org and go to events, and you'll see all the information on my tea party.
And we do still have that link. It's going to be continuously on our Facebook Live and also on our chat. And we're going to wrap it up with a big, beautiful bow of pink. Thank you, each one of you, for the beautiful support. And let's pass on the mammogram one time at a time. So thank you all. Anything else last minute? Any questions? All right. Have a great day, guys.
Thank you.
Thank you.
We'll see you at the next tea party.
Yes.
COVID free. COVID free. Cross your fingers.